Open. Speaking of real news, let me bring in Jeffery Jaxen to go over what actually happened in the last 7 days since our last episode of the Highwire. Jeffery, thank you for joining me.
Hi, Del. Thanks for having me.
All right. First of all, you know, I rarely get to point this out, but not only are you doing all of this great research for us and following what's going on the Highwire, there's so often times that I can't cover everything that we're talking about, and you've been writing you have an incredible blog going on at thehighwire.com called the Jaxen Report that is bringing nuance and deeper facts and points to many of the things I'm talking about. So I want to thank you for that work, and everyone should know you really got to stay in tune with the Jaxen Report every week. For those of you that know how to read, it's really a great way to get your information. All right, Jeffery, what happened this week?
Well, let's like we normally start. Let's go over the numbers. So the U.S. has a little over 432,000 cases and 14,000 deaths. Below that is Spain and then Italy. Spain has 152,000 cases. Italy has about 139,000 cases. But what's really interesting here with the numbers is I think everyone should pay attention to what Dr. Deborah Birx said. She's part of Trump's coronavirus task force. And she recently made an announcement that regardless of any underlying health issue that could have contributed to the loss of someone's life, they're going to count someone that dies with COVID-19 as dying of COVID-19. So this is a very interesting point because we know that a lot of from the research, the cases of people that are dying from this or catching it as well have underlying health conditions. These are people typically older.
And this is what we've been reporting on, right? This is exactly, we talked about the death certificate. We said it looks like they are trying to bolster the numbers. And in fact, I think we have the video of her saying exactly that. Let's take a look at this.
So I think in this country, we've taken a very liberal approach to mortality. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
It's amazing when you report something and say that this is what is clear. When we showed you the death certificate last week, that they are promoting the idea, forget that they had cancer and were in ICU anyway, or forget that they had an underlying, heart disease and condition that was probably going to claim their life this year. We just want to see this as a COVID-19 death. I've been talking about this in my house, and my 11-year-old son actually asked me the question. He's like, so Dad, if someone's in a car accident and they end up like chopping off their arms and legs and they're now in the ER and they end up bleeding to death, but while they're in there, they're tested positive for COVID-19, are they going to call that a COVID-19 death? And I honestly think, I looked at my 11-year-old son and said, you know what? It's a really good question. Based on what we're seeing here, they do not care if it's COVID-19. If you're dying with it, then you're dying from it, it flies in the face of what we're told coming out of Italy, right? That in Italy, they said when they went back, they clearly saw that 88% of the cases, you had to say those underlying conditions are what killed them, not the COVID-19. So they're really bolstering these numbers. And they're saying it right to our faces. We are going to blow these numbers up. In fact, you have a couple other reports that show reasons they might also, in ways they might be bloating this. What's that about?
Yeah, well, another possible angle is the CARES Act. This was the stimulus package, the third phase of the stimulus package passed last week and signed by Trump. The CARES Act reimburses hospitals' Medicare rates for the care of uninsured COVID-19 patients. It also adds 20% increase in Medicare reimbursements for COVID-19 hospitalizations. So these are two data points that are very interesting when you start looking at these data numbers.
So they're actually saying, if you call it a COVID-19 death, we're sending more money your way. You don't have to worry about if that person in the ER is uninsured. Don't worry about it. They'll be covered as long as it was COVID-19, and we're seeing a big problem with this. We're seeing doctors, and I'm not going to get deep into this because we know it's happening now. This is now becoming a mainstream discussion that the Highwire shared just last week. We see doctors speaking out against this, saying, this is insane. I've never had to do this before. Yes, I've had patients in the past that were dying of heart disease or lung disease or cancer that had the flu, but they didn't tell me I had to call it a flu death because that made no sense. And now they're tying my arms behind my back. You can go online and see these videos everywhere. All right, let's talk about the numbers. Where are we at? What else has happened this week?
Well, there's been a big pushback towards the World Health Organization. It started, I mean, arguably wherever it started, but last week we saw the Deputy Prime Minister in Japan come out and really rail against the World Health Organization. In the article, he said, quote, people think the World Health Organization should change its name. Deputy Prime Minister Taro Aso said while speaking in the Japanese parliament on Wednesday. According to translators, it shouldn't be called the WHO. It should be called the CHO, which was the China's health organization.
Wow.
So those are big words to say in a parliament by a deputy prime minister. And then right after that, you have President Trump. This was 2 days ago on Tuesday. He came out and said that he announced that they were going to cut funding, the U.S. funding to the World Health Organization. He later backed it off a little bit, but the president's 2021 fiscal budget package does have in there that they're going to take away from 122 million that's the U.S. is funding the World Health Organization. They're going to bring that down to 58 million. And the U.S. is the largest funder of the WHO, which is something that I wasn't even aware of.
I mean, amazing when you think that the WHO really has been driving this entire discussion. Everything we knew coming out of China came through the WHO. I saw Donald Trump clearly upset, feeling like either he was lied to or there's total incompetence. I was listening to the Secretary of State Pompeo say yesterday that, look it, America pays for services. The reason we pay for those services is that they have to be accurate and they've got to do their job. And if they're not doing their job well, what are we paying for? So I think it's a gigantic question now around the World Health Organization. And when we start thinking about Bill Gates, who is a giant funder of the World Health Organization and seems to be using the WHO as some form of microphone to the rest of the world, I think we have to start wondering who's running who's telling the truth. Is China in charge? Is Gates using China? WHO? Really, really big questions we're going to continue to look into. I think it's a fascinating story. What else we got? I mean, geez, it's amazing, right? Every single day, the news is just exploding. What else?
It's incredible. One last side note on that. We will come back to the WHO before we're done here. But there was a change.org petition to remove the Director General, Dr. Tedros. I'm sorry, he's not a doctor. He's the first WHO Director General that's not a doctor.
Wow.
Had about over 770,000 signatures so far, and that started in January, end of January. So there's a lot of growing discontent there. But moving on to Austria. So Austria and even Denmark, they are announcing plans. Everyone's saying, when is this quarantine going to let up? This is the big news now as we're going into weeks and weeks upon this. Austria and Denmark are planning to lift restrictions in stages. So Austria wants to start with small shops. They're slated to reopen April 14th, and then larger stores to follow, hopefully on May 1st. So we're seeing those two countries making a positive move, to try to reopen their economy. Meanwhile, U.S., Germany, Britain, they're talking about proposing splitting up the population with immune and non-immune people.
Wow.
So
April 14th.
We had something came out from the St. Louis Fed. They're proposing a daily test to get back to work, to start the economy. So this was out of St. Louis. President James Bullard laid out a system where every American would be tested every day, and they would wear a badge where they would show, kind of like after they vote, he said, that they would show their immune status, which is an interesting proposal. But we see a lot of the health and immune response and antibody response being tied in now with getting back to work. can you work? That's the big thing. And Robert Redfield, director of the CDC, just came out. This was today, and they announced that essential workers can go back to work. This is healthcare workers. This is food supply workers. Yep. And they just need regular temperature checks. They have to adhere to social distancing. They have to wear masks, so on and so forth.
Wow, incredible. So a huge shift, and now we are starting to see nations decide it may be time to end this lockdown and move back into society. I mean, it's really scary out there, right? I mean, I think all of us, if you have any working brain cells, so much of this sounds so scary. When we hear about snitches, like I think in California, right, they're saying, you know, you're going to be benefited by snitching on your neighbor if they're breaking the protocols. We're seeing advertisements for bracelets and things you might wear as you walk down the street to say that you are COVID negative or COVID positive or whatever your situation is. I mean, you know, bands and epaulets and things. I mean, from Nazi Germany into Orwellian, you know, science fiction novels, it's happening. It's here. These discussions are real. Really, really incredible. Is there anything else you have to report?
Well, just you know, as we reported last week, we had the jobless claims. They do come out on Thursday here. So we had another 6.61 million jobless claims, and that makes 16.8 million Americans have filed unemployment benefits in the last 3 weeks. So
60% won't be able to meet their basic financial needs. Wow, that's an incredible headline.
So as you said last week. Not surprising, but incredible nonetheless. And you know, let's go back just to end on the World Health Organization.
Okay.
We have their assistant director or executive director of the Health Emergency Program. His name is Dr. Michael Ryan. He made an announcement and said that the countries may look at going into people's homes, essentially finding sick people and removing them with dignity, of course, and safety. But this is an interesting statement coming from a policy, you know, setting organization that kind of puts out this message. And I'm not sure if there's a video of that, but it's interesting to hear him say.
Let's take a look at it.
In low incidence areas where there are sporadic cases or clusters, we advise that all contacts should be quarantined. Ideally, that quarantine should occur in a place other than the home. Most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Wow, a safe and dignified manner. Can you imagine? I mean, imagine Chris Cuomo being dragged out of his house. We don't trust you in there. And I think in some ways it really even defies reason. If we think that the children and those that are young are going to just have a cold, why isn't the WHO just saying, just stay in the house? Go ahead, let everyone in the house, have everything delivered, let everyone get it so that you'll have, you know, your titers, you'll be immune now for life, or at least for several years in the future. Instead, are we literally talking about going door to door, testing family members, watching mothers or fathers or children? What if the child is the one that has it and the parents don't? Are you going to watch your child dragged off? What would you do? If the CDC or some representative for the United States government comes to your house, tests that your child is positive, they have absolutely no decent symptoms, they're perfectly healthy, they're running around in quarantine, jumping on the backyard trampoline, then now the CDC says, I'm sorry, we're going to have to take your 11-year-old child or your 5-year-old child or maybe even your teenager away and stick them into quarantine. I can't believe that these are the types of statements that are being made. And certainly if that's what's coming from the WHO, then I hope Donald Trump will look deeper into whether we should be funding them or not. Jeffrey, thank you so much for bringing us that incredible report and what happened last week. Keep up the good work. And for more of your information, we're all going to be reading the Jaxen report this week.